Today, I want to talk about treatment of leg and foot ulcers in sickle cell disease. Welcome to another episode of Dr. Simone Says. My name is Simone Eastman-Yuan. I am a medical doctor with sickle cell disorder, and I am also the best-selling author of the book, A Doctor in a Patient's Body, Dreaming Big with Sickle Cell Disease and Chronic Pain. But these days, I like to spend my time making sure that every sickle cell survivor becomes a sickle cell thriver because it matters that we live well. It is not a sexy topic, but a few months back, I was asked to give a small presentation in my group online, my Facebook support group, Bedtime Stories with Dr. Simone, because there were a lot of people that were suffering from leg and foot ulcers. And so I did. But I did promise that I would follow up with a more complete presentation for the treatment of leg and foot ulcers. And so that's what I'm going to do today. So, the first thing I want to talk about is what causes foot ulcers and leg ulcers. And to understand it, I think it would be appropriate to look at what happens in a diabetic. So, diabetics also have very poor circulation and they have high blood sugar, and that high blood sugar sticks to the hemoglobin and becomes what is called a glycosylated hemoglobin. And that makes the blood sticky. That makes the hemoglobin sticky. And so they tend to, in the smaller vessels, stick together and obstruct and cause a lot of scarring along with inflammation. And because of that, it will decrease circulation to the tissues downstream. So you might know people who have had gangrenous toes that needed to be amputated and things like that because of poor circulation in diabetes. Well, something similar is happening in sickle cell disease. So, in sickle cell disease, we already have sticky cells because of incorrect genetic programming. So, we have red blood cells that tend to stick together with platelets as well as stick on the walls of our blood vessels, on the endothelium of the blood vessels. And so we already have a predisposition for this stickiness. Then we now can have a vaso-occlusive crisis where we have, for whatever reason, a stress on the body that leads to more sickled cells. Those sickled cells end up clogging the circulation, and before you know it, we don't have any nutrition downstream of that, and that can lead to a breakdown of the tissue because the tissue is now getting very little nutrient, very little oxygen, and so it can lead to an ulcer. The other way that an ulcer can happen is if you have not enough blood circulation. So if you're very anemic and you don't have enough blood cells being able to perfuse the tissue and bring oxygen and nutrients to the tissue, then you also have a problem because the tissue will die. And so that can lead to an ulcer. And then the last thing to think about is infection. So if you have a localized infection on any part of the body, and it's not properly treated, it can lead to a wound, and a breakdown of that wound can cause an ulcer uh, to that area. And so, with sickle cell, it is very important to watch the integrity of the skin and to make sure that the skin is moisturized, especially in your extremities and your lower extremities, and to make sure that you're hydrated because if you have very little fluid in your body, but you have a lot of sticky cells that can clog together. Now you have them in a higher concentration and more clustered together because there's less water in the body. And then you have a higher incidence or higher probability of them being able to stick together and cause a problem with your circulation. So it is very important to be able to think about what's happening so that you can kind of march backward and do preventive steps. So because of so these are the causes of of leg and foot ulcers and sickle cell disease. So let's talk about what you do when that happens. So if you are in a remote part of the world where you don't have proper care of sickle cell disease, much less a wound care center um, or a wound specialist, then you may have to do this at home. You may have to do some preliminary treatment at home. So you want to clean the area, the area that's ulcerated. You want to clean that area with salt water and have it be warm so that it can wash away some of the dead tissue, and um, dry as possible. Salt is a great thing because water follows salt. And so oftentimes, will happen is you'll see increased drainage of the tissue because the salt in the wound is now pulling on the fluid that's in the tissue. And so it will, which is a good thing because it can cause the tissue to kind of dry up and pull towards each other and kind of start um, narrowing, wanting to form over the wound. And so that's a good thing. But you have to make sure that you dry it or keep it dry even as it is producing, more and more water to the wound. So you may have to keep changing out dressings and things like that. But in order, we want to wash the wound, we want to dry the wound. We then want to dress the wound, and we'll talk about what types of dressings are available, or some of the dressings that are available, because we live in a world where there are so many options, but not all of the options are available to you. And so I want to at least um, talk about some simple options that you might be able to find in your home or in your local pharmacy and take home and work on it. And then I want to talk about some of the other things that you may have to order online, or if you live abroad, may ask someone to bring for you when they're coming to your country, etc. Um, so you wash the leg, you dry the leg, you apply the wound dressing, and then you wrap the leg. And this is for circulatory reasons. So a lot of times when you have a wound, there will be leg swelling, and that's not good for wound healing. So you want to wrap it with something like a gauze bandage, or if you are able to get something called a compression stockings or compression socks, that would be great. But you wrap starting from the level of the wound and then wrap upwards until you get to about a couple inches above the knee. You don't want to stop before that because you can end up causing problems with blood return, and so create more of a problem for your circulation. So you want to go a couple of inches above the knee and then stop. And then you keep your legs elevated as much as you can. Now, if you're working, that sucks. You may have to take some time off. If you have that. If not, you need to find ways, even at work, to be elevating that leg, because that leg needs to be up so that it has the best chance of blood return from that area to the heart and the best chance of not swelling. And so that will increase your chances of it getting better. Um, You also want to make sure that you don't get it wet. That wound, that dressing, you want it to get wet only if it is soaking up the exudate, the fluid that's coming from the wound, not from you taking a shower or from any external source. And as soon as it gets wet, regardless of why, whether it's from the wound or from bathing, you need to change it because you don't want the wound to be wet and cause more breakdown of the tissue. So if you're bathing, wrap it with a plastic, wrap it with whatever can keep the water out, really. And then you can remove it after. If accidentally you get it wet, you want to start over with a new dressing because you really need to keep the dressing dry for this to work. And then you if you are taking hydroxyurea, you want to make sure that it is not being caused by your hydroxyurea, because studies have shown that with hydroxyurea, some people are actually getting increased incidences of leg ulcers that are resolving once they discontinue the hydroxyurea. And so you need to make sure that you at least stop the hydroxyurea and see how things fare for you. Does the status change? Does your leg ulcers go away when you stop it? Because otherwise, you're going to keep doing these measures, but it's not going to heal if it's being caused by the hydroxyurea. Um, and that's not to say that everybody has this problem, but for people who do, this is what you would need to do. Um, if you are in a place where you can find a wound care specialist, that's wonderful. You can go to a wound care specialist, and what they will do is they have a myriad of things that they can do. They do a wound debridement, where they try to get off the dead tissue or infected tissue so that they can leave a fresh looking wound to heal. They will apply lidocaine oftentimes to the area to try to numb the area, and then they will try to scrape that dead tissue away. It is uncomfortable, but it's for a good reason, so that you have fresh and tissue margins to be able to pull together to form a scab and to heal. And so, if there is any way that you can be seen by a specialist, that would be wonderful. Um, what do you dress wounds with? There are many things. So, for smaller wounds, you could consider something like the honey dressing. It is a dressing, and I'm not going to go into every dressing and everything that they have, but I'm just going to tell you a little bit about each. But the honey dressing, you can find that online. It usually is there's also a honey paste dressing that you can put on your own gauze and create a dressing um, for yourself. But there are pre-packaged dressings that actually are made with this specific type of honey from New Zealand that actually causes a pulling on the ulcer, on the wound, and pulls the exudate, pulls the liquid out of the tissues, and also keeps the area free of bacteria, and helps with healing that way. That's usually for smaller wounds, but they are available. Um, so, and then if it's infected, then you want to um, be on antibiotics. And this is also tricky because some people live in places, parts in the world that you may not have. antibiotic. I know some people have mentioned that they've had to use the ointment, tetracycline ointment, that is given oftentimes in a clinic, because when a baby's born, they will put that tetracycline ointment in the eye as a first treatment against certain diseases. And so that can be more readily available than some oral antibiotics, but it seems to work. And so people will dress the wound and apply that tetracycline eye ointment to the wound. And usually it's not for the entire duration of the wound, it's probably for like a week or two, just to make sure that you get rid of any infection that may be in the wound, and then you stop. But where you can't get hold of antibiotics, oral antibiotics, it's a nice option. And you usually will apply that ointment after you've washed the wound out with warm salt water. Um, some places have treated with sulfur. I know that here in the United States, when people get significant burns, one of the things they use is silver sulfadiazine, 1%. So it's silver and then it's sulfur, so sulfadiazine. And it's a 1% ointment, and they'll apply it. And that actually works for leg ulcers in sickle cell disease as well. So that's something that could be applied to the wound before it gets dressed and before it gets bandaged. Um, there is also a wound care um, foam that's called hydro Blue. So hydro, HYDROFERA, and then BLUE. And it's a thin foam that's actually bacteriostatic, so it prevents the multiplication of bacteria, or the growth of bacteria, and it actually can prevent even MRSA. I know some people have methicillin resistant Staph aureus, and so it can actually work against that as well. And so it works for all wounds and ulcers, but it doesn't work for third degree burns. So you have to make sure that you're not using it on the third degree burn. We're talking right now about leg ulcers in sickle cell disease. So we're talking about using it for that. And the active ingredient is ginseng violet and methylene blue. Those two are the active ingredients for this hydrofera blue that we're talking about. And normally the dressings are kept on like a week at a time and then taken off. But there may be some others that are used for a shorter period of time. But one of the things that it does is that it actually, as your wound starts to kind of water, because it's pulling the fluid out of the tissue, it then traps that fluid so that your wound stays dry, which is a great thing. So which means you can keep that dressing on for a longer period of time, because your wound isn't getting wet because of the fluid being pulled out of it. And it also helps with debriding the wound. So somehow it helps to pull away that dead tissue that's in the wound as well. So those are some things that make that a great dressing for a leg ulcer. Let's talk about treatment, because treatment is important and prevention is important. And sometimes the same thing that you would do for treatment is what you would do for prevention. So you want to stay hydrated, as we talked about, because that keeps, especially in sickle cell, that keeps your cells nice and separated and decreases the chances of clogging and decreasing circulation to the area. And you also want your tissues to actually be the cells of the tissues to actually be hydrated. the fluid that you're trying to pull off is the fluid that's lodged in between those cells, the fluid that is in the tissue itself, not in the cells. And so the cells you want healthy. The fluid, the buildup of fluid in between those cells is what you're trying to drain out. So you also want to make sure that there's no breakdown of skin, and so you want to moisturize the skin and be on top of any breakdown of tissue that you may see, any little sore or anything, especially in the lower extremity. Have a high index of suspicion for ulcer and treat promptly. You want to wear compression stockings so that you can get good circulation. And diet wise, there is there are some things that you can do as well. Treatment and prevention. So diet wise, zinc powder. I remember in my country growing up that they actually used zinc powder on the wound itself for wound care. Here in the United States, I have seen increase in taking zinc orally as part of wound care. And so right now, that is all that I can recommend, but I have actually seen both. And then if you think about what's going on locally, your your tissue is breaking down. What is that? That is protein. So that means you need to replace a lot of protein. So you need to be taking protein shakes, eating lots of protein in your diet to be able to not only maintain but to repair what is damaged. And so be thinking about what it is you're losing so that you can think of what it is you need to put back. Your vitamins and your minerals are going to be critical because they act as cofactors and enzymes in a myriad of processes in your body. And so, if you don't have those on board, it's going to slow everything down. So, you need to be on a great vitamin and mineral supplement. Now, there are some supplements that are designed pretty much for um, people that are recuperating from wounds, people that are convalescing. One of them you have probably heard about. It's called Juven. And Juven is actually good because it's made by the people who made Ensure. It's great because it actually has whopping doses of L-glutamine. And if you remember, L-glutamine is what Endari is made of. And L-glutamine is supposed to actually decrease episodes of sickling. So right there, it's a great option, but it also has components for wound healing, and that's wonderful. And so you can be using it for both things, um, and um, and so using it for your to decrease sickling, but also to heal your wounds is a great option. Another one that I've heard specifically with people who have leg ulcers is Cellgevity. Cellgevity is a nutritional supplement, and it has whopping doses of antioxidants and a whole host of really yummy things that the body needs. Like um, it has just whopping doses of antioxidants. I think it has um, vitamin C for one in very high doses. It has um, broccoli seed extract that's supposed to protect the DNA against damage. It has turmeric root. It has resveratrol, alpha lipoic acid that combats oxidative stress, milk thistle that usually removes toxins from the body, also removes heavy metals. So if you're getting a lot of MRIs and imaging that have contrast dye, that's a great thing to use milk thistle, because it'll detox your liver for you and remove a lot of those toxins from your body. Black pepper, which helps absorption of vitamin C, and turmeric. It has aloe and a whole bunch of quercetin, grapeseed extract. I mean, a whole bunch of anti-inflammatory, antioxidant things that are great for your body. And so, if you are in a position to get someone to get that for you, that'll be great. You can look on Amazon has Cellgevity. Um, but if you can get someone to purchase that for you, if you live outside of the country, that would be a great option as well. Until next time, this is Dr. Simone Says, and remember, you are a sickle cell thriver, not just a survivor. If you have benefited any at all from this video, please like on the video, comment, and subscribe to the channel, and share the link with one other person as your contribution towards the sickle cell cause. Thank you and have a great day.